The American Heart Association just released new guidelines for cholesterol testing. It's recommending that every adult test their lipoprotein A levels. It's considered a bad cholesterol, and the levels are often inherited and consistent throughout a person's life. It's a key indicator of a person's risk for heart disease. Higher levels mean a higher risk. About 1 in 5 people can have high levels without knowing it because there are no symptoms. The only way to know your level is through a blood test.
Someone who has a family history of relatives who've had to have their aortic valve replaced, elevated lipoprotein A levels have been shown to predict aortic valve disease. So it really is encompassing a lot of different types of heart disease. So that's why it's really important to talk to a cardiologist or just to your family care doctor about your family history.
The American Heart Association also says healthcare teams use a new risk estimate. It's called Prevent. It's a tool that helps estimate your chances for a heart attack or stroke in the next 10 to 30 years. It's based on health info collected during an annual checkup.